Health officials in Texas say a child has died from the measles. They confirm that the child was school-aged and that the child was unvaccinated. It is very sad. It is tragic. The very first death from measles in the United States in a decade. And from a virus that was declared eliminated in our country 25 years ago, thanks to the 2-dose vaccine that the CDC says is safe and is recommended starting at 12 to 15 months of age, and almost entirely prevents the measles, one of the most contagious human viruses. It is also alarming considering this preventable outbreak, clustered in rural West Texas, now has hit 124 cases and another 9 cases in neighboring New Mexico. Most of those cases are among babies, children, and teenagers, and nearly all of them, too, are unvaccinated. Health officials in Texas said today that more than 20 patients have been hospitalized. All of the hospitalized patients are unvaccinated. Officials warn that cases are underreported and that this outbreak is not going away anytime soon, because in Texas and across the country, measles vaccination rates among kindergartners have plummeted in recent years to now below the level needed for herd immunity. Thanks in part to the debunk theories spread by anti-vaccine activists, people like the new Secretary of Health and Human Services, Robert F. Kennedy Jr., who peddled debunked theories about the measles vaccine on the island nation of Samoa. 2 months before an outbreak there in 2019 killed 83 people. Most of the victims were children under 5 years old. Here's how he described the current measles outbreak earlier today. Texas's largest outbreak in nearly 30 years, and with, again, the first death in the United States of America in a decade.
We are following the measles epidemic every day. Incidentally, there have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
Joining our conversation, public health analyst Dr. Irwin Redlener. He is co-founder of the Children's Health Fund and founding director of the National Center for Disaster Preparedness at Columbia University. I know you have thoughts.
Oh, do I? Yes, I do, Nicolle. You know, one of the most amazing things about this particular appointment of Bobby Kennedy Jr. as HHS Secretary, I would say that he is probably the most influential anti-vaxxer in the entire world, not only in the United States. He's influenced, as you pointed out, the measles epidemic in Samoa. He's been peddling nonsense all over Africa, and it's just extraordinary. Here's what we have now, at a time of national public health crisis, a man who really doesn't even understand the basic principles of public health, and he's now supposed to be setting the policies and running an agency of $1.8 trillion budget and 80,000 employees. It's like, I was going to say, I don't know how we got here, but I guess I do know how we got here, and it's really dangerous. And like you said, we haven't had a fatality in 10 years. Before the measles vaccine was around, we had 2,000 to 3,000 children a year that would die of measles. It was declared eradicated in the United States in about 2000, and that was it. It became like an obscure disease that occasionally breakthroughs would happen. But now we're deep in it again, seeing the reemergence of a disease that should have been long, long gone.
Because we are seeing the reemergence of a disease that should be long gone, some people don't even know what it's like. Can you describe what it's like when your baby has the measles?
Yeah, I can. It's a miserable disease. You know, kids get a very high fever. They get a terrible rash. They get a cough and, you know, a serious cough. And they are really disabled as far as an acute illness for quite some time, till it either goes away or they get worse or they would get admitted to the hospital. And in those cases that didn't go well, like I said, there'd be a couple, 3,000 deaths per year. It was a dreaded disease, you know, like mumps and like these other things that, you know, like modern science and modern medicine has been working on, and we've eradicated. And for some reason, we're reintroducing it, because people are believing nonsense promulgated by the likes of Bobby Kennedy Jr. and many others. And this is a problem. But parents should know, and I just need to emphasize it, Get your kids vaccinated. You get one shot around 12, 15 months of age, a booster, another one between 4 and 6 years of age, and that's that. You don't have to worry about something that should be long gone. So this is basically it, and people have to resist BS. I know this is a family show, so let's just call it BS.
I think Bill Barr ushered that word into our lexicon.
Yes, he did. But anyway, this is, you know, pediatricians are just aghast that we're back here at this point that we were before 1963, when that vaccine was miraculously developed and saved so many lives.
So you're a doctor. How do you square a doctor like Senator Cassidy voting for someone as dangerous as RFK?
I was surprised. You know, there's 4 doctors in the Senate, and all 4 of them confirmed. But Cassidy really raked Bobby over the coals in the confirmation hearings. And I actually was texting with him and his staff and a couple of the other ones. I would have bet that he was going to dissent from that vote. And at the end of the day, he and the other 3 doctors who went to medical school, should know better, went along with one of the great, sad myths of American society today. And it's a shame. It's shocking. And I hope those senators, the doctors in particular, realize that along with Bobby himself, they bear some responsibility if measles truly gets out of control in America. They should have known better. I think they do know better. But like with every other issue that the senators and members of Congress are facing, they're terrified about this, I don't know, mysterious primary thing or violence threats. I don't know, but I'm really worked up about this, Nicolle. It's a very sad state of affairs.
No one's going anywhere. We'll bring everyone else in on the other side of a very short break. Stay with us.
I think what we need to know about measles is a very severe illness that has a mortality rate of about 3%. And so knowing that when we have large outbreaks, you know, unfortunately, statistically, there's a significant risk of having a death. I certainly hope we don't see any more, but I think we're fairly early still in this outbreak.
We're all back. Importantly, that was Dr. Laura Johnson, Chief Medical Officer of Covenant Children's Hospital in Texas, where the child died, and basically having to fact check a sitting HHS secretary who said 2 people have died, but we're watching it. 20 people are hospitalized, mainly for quarantine. I don't think that's the case either. I don't think they're just quarantining.
I don't know what they're actually doing, and neither does Bobby Kennedy Jr., apparently. So we'll have to see how this plays out. But right now we have actually a critical situation. So when we used to have, like, you know, 2,000 or 3,000 deaths per year, we're talking about millions of children potentially getting it. So the fraction was very small. Now we have 124 cases in Texas, 9 in New Mexico. So the denominator is
20
very
in the hospital,
right, and then, but the denominator is very small. Yet we're still seeing a death, maybe 2 deaths, and a bunch of kids hospitalized. This does not bode well for what we might be seeing in the very near future.
It's an amazing inversion of America's role in the world. And again, back to the autocrats playbook. I mean, autocrats would love to see America not just divided, but divided and sick. And the reason PEPFAR came to be, the reason USAID existed in a lot of places, was to vaccinate children so that children were spared the brutality of wars and autocracies. And here we are in the United States of America, 5:30 p.m. on a Wednesday, talking about a measles outbreak.
And that was one of the benefits of a central government, that they made rules that benefited everybody. I mean, your figure of a few thousand people who died in the U.S., I was looking at the World Health Organization estimates that 6 or 7 million children died every year before there was this vaccine. I mean, it's horrific. And part of the thing that is also, there's kind of a scientific illiteracy. I remember reading that famous study about the flu vaccine, where people think all these anti-vaxxers think the flu vaccine gives you the flu. Well, it was a British study that showed that about 10% of people who got the flu vaccine already had the flu but didn't know it, and then they became symptomatic after the vaccine, and they assumed it was the vaccine rather than the fact that they'd got it. That's the same thing I assume that happens with these conspiracy theories around the MMR vaccine.
Right.
Is that right?
That is right. And once you start getting into conspiracy theories, you've thrown science out the window, so you don't know what studies you're supposed to depend on or what the media is supposed to report on. And therefore, if the media is the communicator and they're getting these mixed messages and they're mixed with nonsense, it is very difficult to have an educated public say we're not going to tolerate this, which is why at the end of the day, who's in charge of the CDC, who's in charge of HHS is critical. And by the way, to your point, Rick, the United States CDC and the Department of Health and Human Services were the most respected in the world. You know, so it's like we're dealing with our problems domestically, but we have an influence internationally.
Yes.
We withdrew from the World Health Organization.
Right.
We're talking about unpredictably wild, inappropriate actions by the administration around public health.
And some of this is a response to COVID, right? To the hostility towards doctors from COVID, the anger on the right and, you know, on the left for not getting it right immediately. And I wonder if you could talk through, like, it almost feels like we're causing more problems for ourselves in this way as a response to COVID. Do you have any sort of historical precedent for what happens in a post-pandemic, you know, America?
Well, this was very, very different for a lot of reasons without going into the details about it. But what happened was, one of the things that we observed was, listen, on the Democratic side, as well as the Republican side, I wouldn't call us, you know, getting a grade of A in our communications abilities. And I'm sure for people in the media, journalists were aware of the fact that one day the CDC would say X, and a week later, without really understanding the basic principles of communicating during a crisis. This was a terrible crisis. People were hungry for good, honest, scientifically based information during pandemic, and they weren't getting it. And yes, that had I think your point is extremely well taken. That was a major blow to public confidence in medicine and science, and it's going to be a long time before we recover from that.
Is the accurate information about what people can do if their child is either under-vaccinated or unvaccinated still available on the CDC website?
I looked at the CDC website today, and most of it is still there. What we're going to be seeing, I have from, I think, pretty good sources, is they're going to be watering it down. So what looks like recommendations or requirements are going to become really kind of voluntary. Yeah, you want to get your kids vaccinated, you know, that'd be okay. We're not going to stop you. And Bobby Kennedy Jr. is famous for saying that we're not going to stop anybody from getting vaccinated. That's not the way you do public health. That's the way you do cosmetic surgery and getting a hair transplant. You know, you say, would you like to get this? Well, we'll think about it. The public health perspective is we have to protect you and you, but the whole population. Everybody here has got to get protected, and the only way to do that is with public health requirements. That's a governmental responsibility that Secretary Kennedy doesn't seem to appreciate, unfortunately.
Thank you so much for being here and joining us. Sadly, I think we're going to continue to, not sad to see you, but sad that we'll continue to have these stories. Dr. Redlener, Christy Greenberg, Rick Stengel, Molly Jong-Fast, thank you all very much for being here today. Another break. We'll be right back.